This is for all the PTs out there. Hi, I'm Dr. Caleb Slater. I'm an expert physical therapist and I'm certified in Mckenzie, which is one of my favorite areas of specialties in the orthopedic world for physical therapy. But there's a few changes that I've made to the Mckenzie approach that have significantly improved the outcomes for my patients. And one of them is not focusing on the most distal relevant symptom, but actually the most proximal relevant symptom. For example, if a patient came in with hip pain, thigh issues, knee pain, and pain all the way down into their foot, into their big toe, Mckenzie would likely say to treat the L4, L5, maybe L5, S1 body part. But our body doesn't really work like this. It tends to work down and out. The above spinal levels primarily will affect the below spinal levels, and it doesn't really work the opposite way. Yes, you can get some biomechanical changes or some stiffness or some neurodynamic changes, but again, in general, our body, specifically the nervous system, works down and out. So instead of categorizing this patient as an L4, L5 issue, a lower lumbar, I actually categorize them as an upper lumbar issue, and I treat this first, and often treating this area of the spine either through mobilizations or repeated movements like Mckenzie practices, I see significant improvements in their distal symptoms. So for me, this has worked a lot better, and it's the approach that I would suggest a lot of Mckenzie trained providers try with their patients, especially with the ones that aren't improving with your typical approach.